Good afternoon, everyone. Welcome to PF Caregiving and what to do and where to get help. I'm Amy Wardzella, Vice President of Development, and I'm honored to join you all today. Before we get started, a few housekeeping notes. Please locate the control panel at the bottom of your screen. If you experience technical difficulties, please use the Q&A feature at the bottom of the screen. This is also where you can submit questions for the presenters. We will address as many questions as we can at the end of today's presentation. There's also a captions button in this panel. If you need closed captioning for any reason, it may be located under the More button if it isn't at the bottom of your screen. We ask that you don't use the raise hand feature during this session. Sessions are being recorded and will be available on the PFF YouTube channel soon. Slide decks are available for this session and all sessions throughout the day. Our speakers today are Lanier O'Hare and Jen Simakaitis. Lanier O'Hare is a nurse practitioner working in the interstitial lung disease program at University of Alabama at Birmingham. Her research is focused on quality of life in interstitial lung disease. As manager of the PFF Help Center, Jen Simakaitis responds to all inquiries received by phone at 844-825-5733 and email to help@pulmonaryfibrosis.org. She provides one-on-one disease education to pulmonary fibrosis community members and helps connect them with the range of programs, resources, and educational opportunities available through the PFF. Jen also facilitates PFF Voices and PFF Caring Conversations, our virtual support groups. Prior to joining the PFF, Jen worked on special projects for community-based and patient advocacy nonprofit organizations. Jennifer graduated from Miami University with a Bachelor of English. She's also a certified professional coach. Ladies, go ahead and take it away.
All right. Let's see if we can work through my technological ignorance. Give me just a moment. I'll get this pulled up, okay? Let's see. All right. Can everybody see my slides? Perfect.
We can see them.
Yeah. All right. Well, I'm thrilled to be here today talking with you about caregivers. Caregivers, as you are well aware, play an essential role in the lives of individuals with pulmonary fibrosis. Many caregivers never imagine themselves being in this role. It just sort of happens out of necessity. And evidence shows us that most of the caregivers are ill prepared for this role. They enter this role with little or no support, but caregiving can be many things. It can be satisfying, yet exhausting. It can be joyful and frustrating, two things that can coexist but are diametrically opposed. So to prepare for or enhance your journey as a caregiver, we look to knowledge as power, and it's my hope that the information that's shared here today will help better prepare you on your caregiving journey. So with that, this discussion will go over an caregiving overview, and then we'll get into some of the common challenges and the emotional toll that can be associated with caregiving. So how do we define this unsung hero? What is a caregiver? Well, it's a person that gives care to people who need it. This might be family members, friends, healthcare workers, or social workers that provide care for individuals with chronic illness. Now, what type of care are we looking at? Well, there are many intertwining activities that a caretaker or a caregiver will be responsible for. So direct care at the top we see is directly caring for the person. This may include physical care, emotional care, listening, talking, giving reassurance. and service to help meet the needs, physical and emotional needs for someone. This might include shopping for food, driving to the doctor's office. So the direct care can involve many different things in and of itself. The next activity that a caregiver may engage in is maintaining the environment. This is maintaining the immediate physical environment in which the person lives. This may include household chores, doing laundry, cleaning, yard work, paying bills, doing taxes. So, in addition to maintaining the environment, caregivers can also help nurture relationships. These are connections that you have with friends and family. You may, as a caregiver, help invite people over, facilitate phone calls, set up a group on social media, start a blog. So there are many different things that a caregiver can do to help nurture relationships for the person they're caring for. And then the administrative duties, all the hours spent on hold or otherwise with insurance companies, healthcare systems, doctors' offices, and keeping meticulous notes of these interactions. These are largely unpaid administrative duties that caregivers will engage in. And now, self care is another caregiving activity that's generally not included in the list of activities for caregivers, but it is often neglected and it's equally, if not more important than the care you are providing to your loved one, is the care that you provide to yourself. So there are many different intertwined activities. You might be engaged in some, you might be engaged in all, and this may change over time. So, looking at the numbers, this is data from the Centers for Disease Control, and we see that caregiving is common. 1 in 5 adults are caregivers, and the majority are women. Almost 60% of caregivers are women. About 1/5 of caregivers are over the age of 65. 37% are caring for a parent or an in law. Now, future of caregiving. We'll get into this in just a moment in more detail, but 1 in 6 non caregivers expect to become a caregiver within the next 2 years. And again, this is data from the CDC on aging. Now, caregiving can be lengthy. Many have provided care for at least 2 years, and almost a third of the folks that provide care have provided that care for 20 hours or more a week. That is equivalent to a part time job. About 80% of the caregivers are going to manage those household tasks, and over 50% provide personal care to their loved one. So there is an increasing demand for caregivers. The total number's been increasing. Between 2015 and 2020, the number rose by 10 million. It went from 43 million to 53 million caregivers. And over the next 10 years or so, an estimated 78 million people in the US will be over the age of 65. More than two-thirds of the US population will need help with tasks at some point. So with this anticipated need, how can somebody prepare themselves? Well, in addition to knowing about the varying caregiving duties, it's equally important to understand the challenges that can be associated with caregiving. Awareness of these potential challenges can put you in a position of being proactive should these issues occur. Nobody wants to be blindsided by potential issues. So, what are some of the challenges we see? Well, caregivers are asked or expected by default to provide care, ongoing care for their loved ones. And again, this could be spouses, children, parents, siblings, all while managing their own lives. Lives that involve the caregiver's own social activities, hobbies, community activities, exercise regimen, working part time or full time. And depending what's required of you, caregiving can be physically demanding, be it from doing chores around the house, helping out with activities of daily living, like showering and dressing, Or maybe it's lugging around oxygen tanks. Those things are not light and they don't maneuver well. And also poor sleep. So, in order to be a caregiver, in addition to being physically demanding, you're going to need to assess the needs of your loved one. And this can involve delving into difficult topics that may be uncomfortable to talk about. These topics can range from things such as prognosis, handling medicine side effects, discussing finances, insurance policies, and advanced care planning, as well as goals of care. I love talking about goals of care because these discussions are so important and they're not necessarily focused on end of life care. They're focused on how you want to live your life. And to be able to do this, you need to figure out uh, a deep understanding really of priorities, goals, hopes, fears, aspirations. And these discussions about goals of care should never occur in a vacuum. They shouldn't be told to you by someone else. These goals of care discussions begin at home and then continue in clinic. We want you to share these goals of care with us as clinicians. And these discussions and goals can evolve over time. They don't have to remain static. And these are tough conversations to have. Actually, there was a project called the Conversation Project, and this was done to help enable people to sit down and have these difficult discussions. And they did a survey of the participants, and in this survey, they found that 90% of the participants said talking to their loved one about goals of care was important, but only a quarter had done so. And about 60% of the folks that were surveyed said making sure their family isn't burdened with tough decisions is extremely important, but only about half of the participants had communicated their goals of care to their family. So, again, these are challenges that are real, they're big, but they are necessary to go through, particularly confronting difficult topics. Now, in addition to those challenges I just discussed, there are health challenges that we see specifically for caregivers. Nearly 1 in 5 caregivers reports fair or poor health. Often caregivers are going to neglect their own health needs, and this actually increases their risk of developing multiple health conditions. Nearly 2 in 5 caregivers are already dealing with at least 2 chronic conditions of their own. And again, these are conditions that often take a back seat with their role as a caregiver. So, learning how to care for the caregiver is extremely important, and we're going to get into that in just a bit. Now, there can be financial strain associated with caregiving activities. Many of the employed caregivers have had to take time away from work, and this can result in lost wages. 2 in 10, or 1/5 of caregivers, reported having to stop work entirely, and you can imagine the impact this has on a household finance. Almost half of caregivers who work had to reduce their working hours to care for their loved one. Almost 80% of caregivers have had to pay out of pocket for routine care and expenses. And this is on average been about $7,200 a year. And this statistic is shocking. Unpaid caregivers provide the equivalent of 470 billion with a B dollars a year in free care. $470 billion a year in free care. That's what caregivers are providing. So, in addition to the physical and financial effects of caregiving, we also need to consider the emotional toll of caregiving. You know, as far as I see it, knowledge is power, and having knowledge of the potential emotional effects of caregiving will make you alert to their presence should you develop them, and you'll be able to manage them or mitigate them. Okay, so the emotional toll of caregiving can look a lot of different ways. We can see depression, anxiety, stress, guilt, frustration, and self medication. So let's get into these a little bit more closely. Studies consistently report higher levels of depressive symptoms and mental health problems among caregivers as opposed to not their non-caregiving peers. Estimates are that between 40 to 70% of caregivers have clinically significant symptoms of depression, and about one quarter to one half of these caregivers meet the diagnostic criteria for major depression. Now, depressed caregivers are more likely to have coexisting anxiety disorders, substance abuse or dependence, and other chronic diseases. Now, anxiety is another emotional toll of caregiving that some people may experience, and this can result from having to manage multiple responsibilities from your starring role as doing everything or a lot of things. Maybe a sense of a lack of control or perhaps a fear of how your loved one is doing or how they're going to do. And of course, the financial concerns that I discussed earlier can also lend to some anxiety. You know, while caregiving it can be rewarding, definitely, but it can also be stressful. About 38% of caregivers describe caregiving as not just stressful, but extremely stressful. Stress can put caregivers at risk for changes in their own health. And the factors that can increase caregiver stress include things like living with the person who needs care, feeling alone, feeling helpless or depressed, having money problems, spending too many hours caregiving, having too little guidance from healthcare professionals, maybe having no choice about being a caregiver, and not having good coping skills and problem solving skills. And another factor that can lend to stress is feeling the need to give care at all times, not having a break. Excuse me. You can also feel guilt as a caregiver, and this can stem from a feeling of maybe you prioritizing your needs above your loved ones. You may feel guilt related to unrealistic expectations with thoughts like, I should have done this, I could have done that. And you may feel guilt that you're still able to enjoy your life in a different way than your loved one, or maybe regret things um, um, in your relationship prior to the illness. You may feel guilt because you can't meet all of the needs of your loved one. About one-fifth of all caregivers feel that they can't handle all of their caregiving responsibilities. And the feeling of guilt can come on if you feel like you're unable to meet other people's needs who may depend on you as well. Um, and guilt has been proposed as being one of the major factors in the development of both depression and anxiety. Now, about 13% of all caregivers feel frustrated. They feel frustrated with the lack of progress that is being made with the person receiving care. And they often feel frustrated from having kind of a chaotic life, perhaps, resulting of, again, having a starring role as a caregiver, a spouse, a parent, an employee. So there can be frustration in dealing with these multiple roles. Now, with the emotional toll of caregiving, sometimes we see individuals self medicating, and this is not always a bad thing. Individuals can handle the stress of caregiving with interventions like talking with others, meditation, prayer, exercise, and counseling is available also. Now, while some have been shown to handle stress with less helpful mechanisms. Um, we see here that increased alcohol use, substance abuse uh, can be self-medicating mechanisms that are not helpful and can actually harm you. Several studies have actually shown that caregivers use prescription and psychotropic drugs more than non-caregivers. 63% of caregivers report eating habits that have worsened. Some are eating less, they cite less time to prepare meals. Others are consuming more saturated fats, having more calories in the day, turning to food for comfort to help deal with some of the stressors associated with caregiving. Again, these are things to be alert of so that you could recognize this if it's starting to occur in your own life. Now I'm going to focus in on women specifically. Remember, about 2/3 of all caregivers are female. They're women. Research has shown that female caregivers sometimes fare worse than their male counterparts, reporting higher levels of depression, anxiety, and lower levels of a sense of well-being, as well as physical health. And this is compared to male caregivers. Women who spend 9 hours or more a week caring for a spouse, an ill spouse, increase their risk of heart disease twofold. And according to one study, there's a dramatic increase in the risk of mental health consequences among women who provide more than 36 hours or more per week of caregiving activities to a spouse. So these are important things to remember as your role in your role as a caregiver. So to summarize, we know that caregiving is common, especially as our population ages. If you're not a caregiver right now, you probably will be in the future. And the caregiving activities are multifaceted. There's so many different roles that a caregiver can take. So get ready to multitask. And while caregiving can be extremely rewarding to be on this journey with your loved one as they navigate their way through pulmonary fibrosis, there are some challenges. There can be financial, health, and emotional consequences that can have a negative impact on the caregiver's life and in turn a negative impact on the individual who they're providing care to. But knowledge is power. Knowledge is power, and we need to know about these potential issues so you can be alert to their development. And it's essential that you care for the caregiver. There is hope and there is help. So in keeping with hope and help, there are a multitude of resources that you may find very beneficial on your caregiving journey. And so I'm going to turn it over now to Jennifer, and she's going to share some of these resources with you.
Great. Thanks, Lanier. Thank you so much. That was a great overview of just sort of what the big picture and what the landscape looks like of caregiving, and it's a lot. So what I would like to do here is, there we go. All right. All right, so can you all see those? All right. So what we're going to go over here is just the challenge for caregivers of finding help and support. Okay, because clearly from what Lanier has established, this is a big job. Okay, so where to start? We're just going to do a quick loose overview here of some first steps that you can take as you're thinking about how to best be a caregiver and engage your team. So one of the first things you can do that can be helpful is to just identify some needs and priorities. You know, whether the person that you're caring for is early on in their disease course or has more significant medical needs, anytime is a good time to start thinking about needs and priorities. So as you're asking yourself these things, what does the patient need? What might they need now or in the future? What do you need yourself as a caregiver? And what might you foresee yourself needing down the road? And in the deck here, which you can download, and I can tell you how to do that at the end of this presentation because there are quite a few links in here. There is this nice sheet from the National Institute on Aging of coordinating caregiving responsibilities. And so it's a great tool, and there's some steps there to walk through thinking about caregiving roles. And then you can think about how you might assemble a care team. So you yourself don't have to be the only person caring for your loved one, okay? And in fact, you shouldn't be, because that is how caregivers end up in some of those difficult places that Linear mentioned. So as you're thinking about who you might put on your care team, you might want to identify who the primary caregiver would be. And in a lot of cases, if it's a spouse, or a close family member living under the same roof, that person is the primary caregiver. But then subsequent to that, you can identify other caregivers and consider what their roles might be. And then, depending on where you are with your needs, you can create a plan. And that will take, in part, considering who those folks are that you want to plug into various roles, what their availability is, what their proximity is, and what their skill set is. For instance, like who on your team is a good organizer or a communicator, who has maybe done some medical advocacy in the past and would be great in that role. Who's a big picture thinker who can kind of look toward the future and think what you might need. Who's a taskmaster or good in a pinch. So, as you're thinking about various roles, it's really important to consider who might be best for those jobs. And then next, you can decide how you'll communicate. So if, later on, as more caregivers are involved in the caregiving, figuring out a method or a system for how you're all keeping in touch with each other about what's going on. So you can do that in simple ways by text, email, or phone. There are also now caregiving apps that help people schedule and track appointments or talk to each other within the app. So those can be helpful as well. And there's a number of those you can check out in the App Store. The Google Play, I think, is the one for Android. And then another easy way to do it is just to consider a shared document like a Google Sheet or a Google spreadsheet, where you can keep track of medications, appointment times, and schedules. So those are just a few thoughts there. And then when you figure out sort of what the needs are, there are definitely resources outside of your care team and in your community that can be a big help. So first off, the easy way to find those resources is to get in touch with your area agency on aging. The Area Agency on Aging is a private or nonprofit entity that is designated by the state to address the needs and concerns of older people at regional and local levels. An Area Agency on Aging coordinates services that help older adults live independently in their home for as long as they can. So the services available there can be things such as meals, transportation, caregiving, other forms of caregiving support, and other agencies or services within your community that can support you. And another resource would be your city, county, or state Department on Aging. And if you contact Elder Care Locator, which is the number and the website there at the bottom of this slide, that's a national organization that it's a single number for across the country. They can help you by using your zip code, get in touch with your Department on Aging, your Area Agency on Aging, and other valuable resources. And then another consideration is local entities like senior centers, senior programs, even some assisted living facilities or retirement communities. They tend to have a pretty good idea of what's available locally. So whereas your area agency on aging is more big picture, and organizations that are generally connected with the state or the county, those local organizations can be a big help as well, and they can have a pretty good idea of what's immediately available to you in your community. And then there's also help online for caregivers. And as I say at the bottom of the slide, there are many, many resources for caregivers online. Sometimes it's hard to know which ones of those are better than others. The ones that are on the screen here are the ones that tend to be a little more comprehensive. So the National Institute on Aging is one. Family Caregiver Alliance, like Elder Care Locator, can help you find those state and county resources in your area. AARP's Family Caregiving section of their site has really nice comprehensive resources for caregivers. And then also caringinfo.com is a really nice hub for online information that's helpful to caregivers. And then the PFF also has some resources for caregivers. So quickly, we have our booklet for caregivers there. We have a web page at the Patients and Caregivers tab dedicated specifically for caregivers. And also, I want to point you toward our support group page, because finding support is it's priceless for folks that are caregiving and that are patients. But we do have a specific virtual support group that we moderate from here at the foundation specifically for caregivers, which is a really nice space to just talk about shared experiences. And then also, I skipped ahead, but going back, you can also contact the PFF Help Center and speak with me, and I can help you connect with those resources as well that we have available for you. Okay, so the next couple slides, I'm going to talk about respite care. And I do want to say, I just will apologize, these slides are really text heavy. But when we're done with this presentation, you can go back and download this slide deck, because most of the things that you see in colored type are actual live links in the slide deck, so that you can click through and find those resources. So after you exit the session, you can go back to the lobby, click on this session, and if you scroll down, the slide decks are linked there, and you can download them from there. Okay, so why is respite care important? So as Lanier mentioned with some of her statistics, the statistics are really jaw-dropping around what caregivers take on. So I've listed a bunch more of them here. This is from a different resource Lanier had. This is Caregiving in the US from AARP and the National Alliance for Caregiving. But just to pull out a couple, 61% of caregivers are working 40+ hours a week. 99% are helping with something related to household duties, so transportation, meals, housework. 72% of caregivers are monitoring a patient's health, and many of those are actually communicating with physicians and taking a sort of a hands-on role in carrying out some of the care for the patient. And 63% of them say they need help with caregiving tasks. So if it's tiring for any of you to look at this, you know what? You probably need a break there. So respite care is the thing that can help a caregiver find that break. Respite care is planned or emergency care that's provided to a person with a chronic illness or special needs to provide temporarily relief to family caregivers. So it can range anywhere from, for someone with higher medical needs, nursing care, to right down to companion services, just to have someone come in and read or play cards with the person that needs care, just to give that caregiver a break. It can be provided by a trained professional through an agency or a private provider or a volunteer organization. And respite care can also be something that you arrange yourself with family members or friends or other people in your community. Respite care can be provided in a home, outside the home in something like a day program, or in a facility. And then if your respite care comes through an agency, it is provided by direct service workers or direct service professionals that are actually trained in how to take care of folks with special needs or chronic disease, so that the caregiver can feel confident about leaving them at home for a while. And so, whoops, didn't mean to advance that. So an important thing when arranging respite care is to kind of plan ahead and think about how you're going to use this precious, precious time. So you're going to want to think about, the kinds of things that you can do both for yourself and the kinds of things that would be also beneficial to the person receiving the respite care, because respite care can actually benefit both of you. So it's a win-win. So for a caregiver, it's really important to choose get the most bang for your buck out of the respite time. So, what do you need the most, and what's going to help you feel more organized or in control or healthy or renewed? So making sure that you schedule those things during your respite time will guarantee that you actually do them and don't just kick the can down the road. Respite care actually can be paid for through a couple of ways. So there are respite coalitions that can help you access funding to contract respite care. Medicaid also provides waivers for respite care. So if you have a Medicaid state plan option for home or community-based services, that might be available in your state. And there also is a link there to a table that shows federal programs that provide funding for respite care. Medicare's hospice benefit, some Medicare Advantage plans and Medigap policies also pay for respite care. And then the National Family Caregiver Support Program that you can access through your area agency on aging may also provide funding assistance for respite. These programs are run at a state level, so states can organize funding differently. So you can check with your area agency on aging to see if there's funding through your state. And then the National Organization for Rare Disorders, which is a patient advocacy organization, sort of similar to the PFF, but they also have a grant program that can provide assistance with respite care costs. And then finding a respite care provider, you can do that through the Arch National Respite Network. So that website that's linked there just provides all kinds of great materials and resources to learn about respite care. And that website is definitely one you'll want to visit. And they also have a search tool to find respite care providers in your area. And that is the National Respite Locator Service through their website. And then also the VA also has programs for caregivers. So if the person being cared for is receiving care through the VA health system, their caregiver will qualify for one of their caregiving programs. So, and these programs provide just a continuum of support and excellent resources. So they can provide both online or in-person trainings. They offer support groups, peer mentoring, and one-on-one coaching. There's a Caregiver Connect app that can help you access the resources that are available through the VA. They can send you caregiving tips by text message, and they also have caregiver resource fairs. So there are two levels of the program. There's the general support services for caregivers, and then if the veterans' health coverage is covering their disease as something that is a service-related disease, then there's even a higher level of support through the comprehensive assistance for family caregivers program. So if you are caring for a veteran and that veteran is receiving care through the VA, I highly encourage you to look into these services. And then Lanier touched on advanced directives in her presentation. Advanced directives really give a person the ability to make decisions about their treatment and appoint a healthcare proxy, so that person can direct their care if they cannot advocate for themselves. These are a legal document. They're not, they don't provide medical directives specifically. Those are taken care of through PULST documents. And PULST documents are they provide guidance and instructions for the medical treatment of people who are seriously ill or medically frail. So these are portable medical orders that a healthcare provider will follow when you provide those orders to them. So they give direction on sort of life-saving measures like CPR, intubation, hospital and ICU admission, feeding tube placement, and other treatments. So it's important, I think, for people with PF and other sort of debilitating conditions to be aware that life-saving measures like CPR and intubation can be traumatic and they can cause discomfort for a patient. So putting thought ahead of when this emergency medical care might be needed is really important to make sure that you're not receiving treatment that you don't want. Because if an ambulance is called and someone and the EMTs arrive at the house, they're going to follow a plan that may include intubation or CPR. And so if that's not something you want, or that your doctor thinks would be, you and your doctor should discuss this and discuss whether they think that would be beneficial. That's something that you can write into your PULST orders. So your doctor and you should talk together about creating the PULST, and the doctor will sign off on those medical orders when that document is completed. And then you'll have them in the event of an emergency. And then there are some other things to think about when planning for future care. So for legal assistance in creating things like advanced directives, the National Elder Law Foundation provides referrals or a search tool to help you find a certified elder law attorney. They are specialists in this sort of thing. They also can provide assistance with understanding patients' rights if they are in nursing or rehab facilities. So they're a great resource for you. And a lot of times they offer a free consultation to tell you about their services. So that's something that you might consider if you want some guidance on putting things together like advanced directives. And then there's some other, there's some other tools here. The first is from the National Institute on Aging that gives some resources on advanced care planning, tips for caregivers and families. And then these other three at the bottom, Prepare for Your Care, the Conversation Project, which was mentioned by Lanier earlier, and 5 Wishes are offer tools to help with your thinking. So they are they offer some workbooks and worksheets that help you think through the process of determining, how you want to be cared for as your disease progresses. So those can be really helpful tools. And then also for things like medication copays, assistance with healthcare costs, these 4 foundations shown here have programs that provide assistance to people who have pulmonary fibrosis. And so they can help with copays, insurance premiums in some cases, and other medical needs. So you can contact those programs if financial assistance would be helpful to you. And then Extra Help is also a program that is offered through the Social Security Administration that is available to people with limited income, and it helps also to pay for drug costs and other medical costs. And so, there have been a lot of changes to Medicare, and there are still more coming next year, including a lowering of the out-of-pocket limit on prescription drugs and the institution of the Medicare prescription payment plan that will allow people with higher drug costs to spread those drug costs out over the course of the year. And information on that is available on the Medicare.gov website. But just so you know, because of all these shifts in costs, there are changes in cost sharing behind the scenes that are changing how the government and private industry and private entities are sharing these costs in a big picture sort of way. And some of that is likely to trickle down in the form of changes to individual Medicare plans. So this year, more than ever, we encourage people to review your plan. I think your plan will provide documentation that should show your changes that will be different. Like if you renew in the coming year, it'll show those changes. You want to make sure that you renew those and make sure that you're not losing coverage for your medications, providers, and whatnot, because networks may change, your drug formulary may change. And you just want to be 100% sure that you're not signing up for a plan that's not going to give you the coverage that you need. So for assistance with that, every state has a state health insurance assistance program that provides trained Medicare navigators that can help you look up your plan, compare it with other plans, and make informed decisions about the plan that you sign up for. And I can't encourage you enough, if you need any help at all, to go to the website listed here, shiphelp.org, or use that phone number to contact the national SHIP, and they can connect you with the SHIP for your state. And then again, if you have questions about anything that was in the slide deck or any of the PFF's resources, I invite you to call the PFF Help Center. We're available 9 to 5 Central Time, Monday through Friday, at the phone number and email listed here. And again, I encourage you to go back to the session area and download that slide deck so you didn't miss any of this information. And that is it. I will stop sharing my screen and we can all come back. Questions?
Thanks, Jen. Thanks, Lanier. What a wonderful presentation today. We have some questions from the community, so if you give me 1 second, I'll go ahead and bring a couple of those up. We'll go ahead and get started with this one. What's the best way to approach other family members about needing help and support as a caregiver?
You had to start with a hard one, huh?
Oh, sorry.
I'm kidding. I think that's different in every family, probably. Some have more open communication than other ones. I don't know. One thought that comes to mind for me might be to just send a general email and to talk a little bit about the kinds of things that you're seeing, and maybe suggest the kinds of help that the person that you're caring for might need, just to get a conversation going about what the landscape looks like. In my family, we've got an in the trenches caregiver who stops in at my mom's house twice a day. And then we've got, you know, the others of us that are far, far away and wish we could be there, but, you know, and we want to help, but, you know, sometimes that can be tough. So whatever it takes to open those lines of communication, I think is a good thing. Lanier, you may have ideas too.
I was thinking of a personal situation, and that occurred. My husband and I were the caretakers of his mother. She lived with us towards the end of her life, and I thought we were doing just fine. My husband became very resentful and upset that nobody else was helping. I think he felt more of a burden than I was able to appreciate he was feeling. And so I asked him to reach out to his brothers to let them know how he was feeling and to see if they were able to offer some support. And every single one of them did in a certain way. You know, some live far, far away and they offer different types of help. But I tell that story because that was just something as simple as expressing your needs as a caregiver to family members. And I mean, I was shocked. Everybody stepped up. Everybody stepped up in their particular way, but they didn't know they needed to until he relayed that. My husband relayed that to them. So make your wish, make your needs known. And however that looks with the dynamic of your family or friends or church family, whatever it is. Great question.
And you know,
Wonderful. Thank you.
there are certainly some things that people who are caregiving long distance can do. They can help with finances. They can help with, you know, planning for the future. I mean, there's those hands-on caregiving tasks, and then there are a lot of other things that can, like administratively, that can be done from afar, that can really provide some relief to the person who's providing the hands-on caregiving, for sure.
Thank you. Are there educational topics during caring conversations, or is it a chance to talk / hear from other caregivers?
It is mostly conversation. And that's kind of the way I moderate that group, so I can speak directly to it. But as the group has evolved, you know, we do share resources, and you know, every once in a while I might do a brief presentation on something, but we do spend a lot of time talking. I really found that in that group, the resources that the caregivers are sharing with each other, and just that opportunity to be heard is super valuable. So,
Thanks, Jen.
yep.
Next question is, how do you discuss advanced directives with the person you're caring for if they don't want to discuss them?
That is one of those very difficult discussions to have. And you can't make someone have the discussion. So you need to give them space, but also it's a good time to ascertain what those fears are. Say, fine. We don't have to do an advanced directive today, but can we talk about why you don't want to work on that right now? What's going on? What is your fear? And take it from there. You know, there's not a timetable. You got to get it done immediately, but it should be done. And if the person, if your loved one is apprehensive about having that discussion, try to find out why, if they're willing to articulate that, and start there. Um, it might also be helpful for the person, that you're giving care to know that the advanced directive is not just for them, it's for the caregiver as well, so that they won't be put in a position of having to make decisions for their loved one. This is an empowering opportunity for the person with pulmonary fibrosis to make their needs known. Okay.
Mhm.
You know, it's a tough discussion to have, but don't try to shove it down their throat if they're not ready. Try to find out what the fears are, and maybe talk about it from your perspective, the caregiver's perspective, how it will be helpful for them to have that discussion when they're more comfortable.
Couldn't agree more. And I also think that it's really difficult to have these conversations when a person is really sort of further along in their disease course. So potentially having those conversations earlier before it becomes a really heavy and loaded conversation might be better. So, and I do think there's this sweet spot, where it feels too early to be talking about that, and it feels like this is really heavy and hard. And I agree with what Lanier said too about, it's kind of really an act of love on their part to be taking their caregivers' needs and well-being into consideration, that those advanced directives are for you, and they're also for your caregivers as well, the people closest to you who want the best for you and want to do right by you and need to know how to do that. So
Yeah. And here's a thought, and I don't know any data behind it, but maybe turn the tables and have a discussion of the caregivers, advanced care planning, hey, you don't have pulmonary fibrosis, but what if something happens down the road? What what do you want to have done? And maybe turn the table and have the caregiver have maybe a mock advanced care planning for themselves. I don't know.
yeah, and I will say too that having looked through some of those like the conversation project documents, they really are thought provoking, and they don't feel they kind of feel very big picture. And like you or I could sit down and do those documents. It doesn't, you don't necessarily have to have a life-limiting or chronic disease to have these documents be relevant for you. I mean, I think at a certain point in our lives, like we should all be doing this sort of thinking, right? So,
We're all born
yeah,
with a terminal condition of life, but
yes.
unfortunately with pulmonary fibrosis, it's sometimes staring you in the face, and it's difficult to broach that topic. Very difficult, but I agree with you.
Thank you. Our next question, how can palliative care support caregivers?
I was going to say,
Go ahead.
Linnea, I'll let you go.
Let
Go,
me,
girl.
palliative care, it's that extra layer of support, of course, for patients, individuals with the disease, to help with whatever they need. But when we look at palliative care, it's essentially a buffet of services, right? And you kind of pick and choose whatever's applicable to you. And so one of the things in our palliative care practice here where I work, one thing that they do for caregivers is offer counseling. Okay. Offer counseling to help navigate caregivers through the feelings that they're having as caregivers, working through those stressors. So counseling is one of the big parts that palliative care has to offer caregivers. And of course, if they see services that are needed outside of their purview, they can send a referral. But counseling is the most common service that we see our palliative care team use with caregivers.
That's
You know,
wonderful. Thank
And I
you.
would also say too, for people that are long distance caregiving, knowing that palliative care is in place, so that a caregiver has access to, if you do have that occasional check-in with a nurse or someone on the palliative care team, it's just this other layer of contact with medical professionals, because you get in to see your pulmonologist not as frequently as I think a lot of caregivers would like, because there are so many questions, and having that opportunity to ask those medical questions of somebody who can actually answer them for you from a medical perspective is really a comfort. And I think as a person who was doing some long distance caregiving, just knowing that that was available to my mom was really, really a comfort.
Well, great questions, everyone. I wish we had time for more, but I'd like to thank both Lanier and Jen for the information and the helpful presentation. I hope you all feel the same. I'm certain everyone here learned quite a bit from both of you, and we appreciate your time and all you do for the pulmonary fibrosis community.